Good morning, students. Today we are going to discuss about another topic in advanced healthcare care planning, which is stakeholders in health system. So, what are stakeholders? Stakeholders, in general definition, we can say stakeholders are a group of people, community, organization, which can affect and can be affected by the action of an organization. Let me make more clear. Suppose whenever the government is making health policies, so who will affect with that health policies and how health policies will affect it? Public consumers affect with the health policy, and because of that the public consumers, the health policy can be affected. So this is all about stakeholders. Stakeholders could be only one person, a group of people, a community, or a government, which can affect and can be affected by any kind of action which is taken by the organization during the making of any kind of policy. So we have three types of stakeholders: external stakeholders, interface stakeholders, and internal stakeholders. The first is external stakeholders. External stakeholder mean to say which those stakeholders who are not directly involved with any kind of policy making process, but they can affect and can be affected by that policy. For example, your consumer, patient, community, all these are external stakeholders. So second, we have interface. Interface are those people who are linked with the organization during making of policy, any kind of policy. For example, could be your medical staffs, hospital trustee. All those things are the interface stakeholders. Now we have internal stakeholders. In internal stakeholders, we have all kind of professional, non-professional, management staffs, which is always on the what we call on the top level while making any kind of policy. It could be health policy, and if we are talking about in general, it could be any policy done by in a business. So this is the differentiation of the stakeholders: external, interface, internal. We have another types: secondary, primary, and secondary. Primary, which is directly involved; secondary, those who are indirectly involved with that health policy. So primary, all that medical staffs, your management, your professional, non-professional staffs, government staffs. And secondary, your consumer, your patient, your service, those who are having that services, all that comes in a secondary. So now let's talk about types of stakeholders. First, like I said, the government is the first stakeholder. Second is the public. Third, we have health providers, hospitals. Fourth, we have NGOs, non-government organization. So the first stakeholder is government. Like we all know that any kind of policy, whether it's a medical profession, whether it's a business profession, start from the top level. Top level is under government supervision or in the government. We have types of departments in the government. Firstly, the finance department. So finance department, if we are talking about the health, so in finance department we have health institutions, the government health institutions. What they do, they have the permanent place in the parliament. So what they do, they always monitor health issues in the country. So like we all know that every year we have that financial year when they announce all type of budgets, and we have one budget for a medical. So because of we have that medical institution or medical department in the parliament, so what they do, they make budget for the health policies. What types of policies we are going to start in upcoming year and how much money we are going to invest on. So they create that budget. So the first step is the government who create financial structures for health policies. Because of that major fear, the federal government has an active participation in regulating healthcare industry. Public has a stakeholder in health system in different perspectives. Like as a consumer, we always demand that we can easily access the health services. Health services shouldn't be costly. Health services should be easily approachable. Most of the people, they think like that the health treatment should be free for everyone in the universe. In addition, public have more positive view regarding health promotion and illness prevention than in the past. Next we have health providers. So health provider provide directly care to the patient, to the client in variety of settings like hospitals, clinic. In the hospitals, physician can easily allocate the resources, health resources, which help during policy making. How? There is only a physician who can understand the time patient need to stay in hospital, what type of medicine we need to give to the patient, when you are discharging your patient, when the patient is going to admit. This is all done by the physician, and because of these things they can allocate the resources, because the therapist or physician know what type of treatment, what type of medicine, when the patient is going to stay in hospital and when they are going to discharge patient from the hospital. So through all these understanding, they can allocate the resources according to that. And we have staff nurses, we have paramedical staffs, and they have their own functions, they have their own what we call active participation during giving a proper treatment to your client, to your patients. We have different types of health providers, community health providers. What are the community health providers? Community health providers are those health providers who are staying in the community. They are selected, the people are selected from the community as a health provider so that they can understand the condition of the society. What they do, they educate the people about health conditions, about hygienes, a proper health education. And they always try to find out health problem from the society. What happened more? Whenever we are going to implement any health policy, we need survey, we need findings. Who do that findings? Health provider do the findings, because they are in the people. So they do surveys in the society. From there they understand what kind of problems the society is facing, how long they are facing, and why they are facing risk factor in the environment, everything. They analyze everything and they send all the details to the government. With the help of that survey, the government create the health policy on a targeted population. So this is our third stakeholders. Fourth, we have NGOs, non-government organization. What they do? They're not linked with the government. They're the private organization. They always try to collect money from rich peoples. And they always try to use that money for the welfare of the society. Sometime in health treatment, sometime maybe in social need. If someone need, socio-economic factor, poverty line. In poverty, maybe someone needs money. Someone need financial support. They do that thing. So NGOs. So here we have the 4 major stakeholders, which I discussed already. So thank you so much, students.